In this video, we use a tablet to demonstrate the software. Please note that the software may appear slightly different from the most recent version of software and from the view on a compatible phone. After you have paired your Vscan Air SL probe and you have entered the preset menu, select Cardiac Guidance from the Tools list. The default protocol will begin automatically. However, if no default protocol has been set, you will need to select a protocol. To change the protocol, tap the back arrow on the left panel next to the protocol name. On a phone, you'll need to swipe to the right first. Don't forget, you can create new and edit existing protocols. See the Scanning Protocols video for more information. Once you've chosen your protocol, follow the static guidance on the screen. Begin by positioning your patient in the optimal position. Here you see that the static guidance is telling you to position the patient on their left side. If the patient is unable to lie on their left side, images can be acquired with the patient lying flat on their back. On the left side panel, you will see initial probe placement information, as well as a reference image of the image you are trying to acquire. Locate the physical orientation marker, also known as the indicator, on your Vscan Air SL probe. Knowing where the indicator is critical when capturing images of the heart. Begin scanning by making large circular sweeps in the cardiac window until moving anatomy appears. Once cardiac structures are visualized, prescriptive guidance will provide movement cues to follow. As you follow the guidance, make small and slow movements, watching how each makes the quality meter respond. As you get closer to a diagnostic quality image, the quality meter will rise. Once the quality meter reaches the green zone, hold the probe still to enable auto capture. Auto capture requires you to keep the quality meter in the green zone for at least 2 seconds. If you are unable to keep the quality meter green for 2 seconds, you can always use Save Best Clip to record the best 2-second clip of that scanning session. On newer versions of the software, Save Best Clip is a smaller icon, but it works the same. If you are a more experienced user, you can also tap the Store or Freeze icon at any time to capture a video clip or single-frame image. You will see a blue box move from the bottom left of the screen to the top right, indicating a view has been captured. Auto EF estimates are available once you capture a Plax AP4 or AP2 view of sufficient quality. The Auto EF is shown at the bottom of the left side panel as a percentage and will update as you add more views that contribute to its calculation. On newer versions of software, swipe to the right to see this left panel and to see which views contribute to the Auto EF. In this version, you select the Views tab. The views with EF beside them are those that can be captured to contribute to the Auto EF calculation. Once you have captured the last view in your protocol, the guidance software will stop, and you will receive a protocol complete notice. From here, you will enter free scan mode without cardiac guidance. To review your images, swipe from right to left to access your image gallery. Tap on an image or video clip. Here you can also review the Auto EF report. If you have multiple Auto EF reports, choose the last one in the gallery. This will be the most recent measurement. For further information, including how to save a study, please consult your user manual. Ultrasound is an imaging technique used to image structures inside the body using high-frequency sound waves. Ultrasound does not travel well through bone or air. So when scanning the heart, we need to scan within the intercostal spaces and minimize lung interference. To do this, if the patient is able, we position them on their left side with their left arm raised over their head. There are 3 locations, known as acoustic windows, used to image the heart. They are called the peristernal, apical, and subcostal windows. To remove any outside air, we apply ultrasound gel to the face of the probe and apply adequate pressure when scanning. In this video, we use a tablet to demonstrate the software. Please note that the software may appear slightly different from the most recent version of software and from the view on a compatible phone. Static guidance is a feature that informs you of how to begin your scan through 3 components: patient, probe, and picture. For patient, the software will provide a brief prompt regarding optimal patient positioning for each acoustic window. It is best practice to scan peristernal and apical views with the patient positioned on their left side with their left arm over their head. However, this may not always be possible, and images for these views can be acquired with the patient lying flat on their back. For the subcostal window, the patient should lie on their back with their knees bent up, if possible. Probe guidance informs you of where to position your probe on the patient's chest and the direction in which the indicator should be pointing. This is indicated by the green or blue dot on the orientation diagram. This diagram will change depending on the view you are trying to acquire. In this example, the green dot is pointed towards the patient's right shoulder. This picture provides you with a reference image of the view you are trying to acquire. Remember that all patients are different, and your image may look a little different than the reference image. In this video, we use a tablet to demonstrate the software. Please note that the software may appear slightly different from the most recent version of software and from the view on a compatible phone. Prescriptive guidance appears in real time, providing turn-by-turn guidance. Understanding how to make these movements is crucial for effective usage of the software. It is important to note that all guidance movements are to be made in relation to the patient. Please note that the prescriptive guidance icons may look slightly different on the most current software, but the concepts are the same. Always make small, slow movements until the guidance goes away or new guidance appears. There are 4 main movement patterns you will be prompted to make. These include sliding, rotating, rocking, and tailing. Each of these movements can be made in multiple directions. Sliding is the movement you will likely perform at the beginning of every scan, making large, slow circular sweeps until moving anatomy appears. It is the only movement performed without your wrist stabilized. For all other movements, you want your wrist secure against the patient to prevent any accidental probe movement or slipping. Sliding guidance is also used for smaller movements, such as sliding up towards the patient's head, sliding down towards the patient's feet, sliding medial towards the patient's midline or sternum, and sliding lateral towards the patient's left side. Rotate is another guidance prompt. Since it is a fine movement, make sure to stabilize your wrist and hold the probe close to its face for maximum control. The 2 directions for rotating are clockwise or to the right, and counterclockwise to the left. Rocking and tailing are both angling movements and are performed along different axes of the probe. Rocking refers to movements performed along the indicator axis. Since the indicator is only on one side of the probe, the directions for rocking will be to rock towards the indicator, or to rock away from the indicator. Tailing is the second angling movement that is performed along the non-indicator axis. The tail also refers to the end of the probe. You can make tailing movements in 4 different directions, depending on the view you are trying to acquire. For example, when scanning the parasternal long axis, with the indicator pointing towards the patient's right shoulder, you can tail up towards the patient's head, or tail down towards the patient's feet. If you are scanning the parasternal short axis with the indicator pointing towards the patient's left shoulder, you can tail medial towards the patient's midline or sternum, or tail lateral towards the patient's left side. Again, it is important to make small, slow movements so that the software can update and give you new guidance cues as needed. The software also provides guidance on when to adjust the depth. This can be done by tapping the yellow plus or minus sign. Alternatively, you can drag your finger up or down the screen. The software now also has auto depth. If enabled in your configurations, it will automatically adjust your depth, and you won't see the prescriptive guidance for depth. In this video, we use a tablet to demonstrate the software. Please note that the software may appear slightly different from the most recent version of software and from the view on a compatible phone. As you perform the guidance movements, the quality meter will rise or fall as you get closer or further from a diagnostic quality image. When scanning, make sure you are making movements slowly, giving the quality meter time to respond. Good practice is that once the meter changes to yellow, stop and stabilize your wrist, as you will likely only need to make small movements from here. Please note, if you are using a newer version of this software, the yellow part of the quality meter is now white. Do the same as instructed previously. Stop and stabilize your wrist. Only small adjustments are needed from here. When the quality meter climbs and reaches the green zone, hold still. If you can keep the quality meter in the green zone for at least 2 seconds, the software will automatically capture your image, a feature called auto capture. The software can capture up to a 4-second clip if you are able to hold the quality meter above threshold for that length of time. If an image is captured with auto capture, a checkmark inside a green circle will appear. If sound is enabled, you will also hear a ding. In addition, you will see a blue box move across the screen from the bottom left corner to the top right to your image gallery. This indicates that the image has been successfully captured. If you cannot hold the image above the threshold to activate auto capture, use the Save Best Clip feature. This feature remembers your best 2-second clip from the entire time scanning that view. On newer versions of software, this will show as a circular arrow icon, but it will still show as a dynamic percentage. The higher the score, the better the image quality. If you opt to use Save Best Clip, the same blue box will move across the screen to indicate that your best 2-second clip has been saved. In this video, we use a tablet to demonstrate the software. Please note that the software may appear slightly different from the most recent version of software and from the view on a compatible phone. Cardiac interpretation provides an automated ejection fraction estimate. If you capture a parasternal long axis, apical 4 or apical 2 image of sufficient quality, the auto-EF algorithm automatically calculates an ejection fraction. On newer versions of software, simply swipe right to view this panel. If you capture one of those views, you will see an auto-EF report created along with the confidence interval. You will also see which views need to be acquired to increase its accuracy. In this example, adding an AP4 or AP2 will increase its accuracy. Here you can see how many views you have acquired that are contributing to the auto-EF calculation. In newer versions of software, it is on the bottom of your screen. Here, one of 3 views have been captured that can contribute to the auto-EF result. To see which views in your protocol can contribute to calculating auto-EF, here we'll select the Views tab, but on newer versions of software, you'll just swipe to the right from the left edge of your display device screen. As you acquire more views of sufficient quality, the auto-EF percentage will update along with the confidence interval. The smaller the range, the more accurate the output. An auto-EF will not be produced on a specific view if it is not of sufficient quality. If this is the case, go to your Views list and try to record a better quality view. On newer versions of software, you'll simply swipe to the right to open the left panel again, and there you will see the empty field. During the exam, you can preview the auto-EF report by tapping here to see if the auto-EF falls within the normal range. On newer versions of software, simply tap the EF value badge on your screen, or swipe right and tap on the EF value on the bottom. Once you have completed your scanning protocol, an auto-EF report will be available in the image gallery. If you have multiple auto-EF reports, choose the last one in the gallery. This will be the most recent. When you select the report and view your final auto-EF, you will see which views contributed to the calculation, and whether the auto-EF falls within the normal range. In this video, we use a tablet to demonstrate the software. Please note that the software may appear slightly different from the most recent version of software and from the view on a compatible phone. You can create, edit, and manage scanning protocols within the Cardiac Guidance tool to best fit your needs. The first time you launch Cardiac Guidance, you will be prompted to choose a scanning protocol. Initial options are the long protocol, short protocol, and the EF protocol. To create or edit protocols, select the pencil icon above the list. Here you will see all existing protocols. Additional indications-based protocols are available, including cardiac tamponade, cardiac arrest, and more. To hide a protocol, tap the eye icon. To unhide an existing protocol, tap the eye icon so that the eye is open. Then tap the checkmark to save. In newer versions of software, checkboxes are used to choose your protocols. Color Doppler Autobox Placement is a new capability within the Cardiac Guidance software that assists trained users in the acquisition of color Doppler subviews by estimating the ideal placement of the color box, and can be adjusted by the user as needed. Please note that auto capture and save best clip is not available while capturing color views. If you would like to create a new custom protocol, tap Create New Protocol, use the eye icon, or checkboxes to hide any views you would like to remove from your protocol. Hold and drag the triple dot to order the views in the protocol as you would like them to appear. A free scan view, or an unguided step, without prescriptive guidance, can be added, which allows you to scan without cardiac guidance. Simply choose the acoustic window. Once you have the views selected and in your preferred order, tap Next and enter a name for your protocol. Then, tap Save. To edit a protocol, select the pencil icon next to the protocol name. Editing lets you hide, unhide, and reorder views or change the name of the protocol. Tap Save. Finally, you can set a default protocol to automatically begin every time cardiac guidance is launched. Tap and hold the protocol for 2 seconds. A star will appear next to the protocol name to indicate that this is now the default scanning protocol. In this video, we use a tablet to demonstrate the software. Please note that the software may appear slightly different from the most recent version of software and from the view on a compatible phone. What should I do if there is no prescriptive guidance? If the image is poor quality without any structures visible, then the algorithm may not be able to provide any guidance for probe movements. In this scenario, rely on the other cardiac guidance features. Remember, you always have continual real-time feedback from the quality meter. When no structures are visible and the meter is low, the system will prompt you to make slow circular sweeps until moving anatomy appears. While searching for the heart, pay attention to the quality meter so that when it starts to go up, you can slow your movements down, stabilize your wrist, and follow any prescriptive guidance that may appear. Another option is to take the probe off the patient's chest and reset in a different spot. You can explore with confidence knowing that Save Best Clip has remembered your best 2-second clip. Cardiac guidance is also very sensitive to depth. For larger patients, depth may need to be increased so the ultrasound can travel deeper into the patient. For smaller patients, it may need to be decreased. On the latest software, this will only show if you have changed your default settings. Lastly, the software will not prompt guidance if it is not confident that a probe movement will improve the image. A non-software feature that is helpful in this case is knowing when and how to control the patient's breathing. In this example, the quality meter gets close to auto capture, but when the patient breathes, the image disappears. Watch what happens when the patient gently exhales and holds their breath out. The image remains on the screen, and the view can be auto-captured. Now that we know what to do if there is no guidance, let's review what to do if there is too much guidance or it disappears too quickly. Sometimes, more than one movement can improve the image. This may mean that both movements need to occur. In this example, the guidance is directing the user to both rotate to see the heart and rock to center the image. Having multiple movements appear may also mean the user is moving too quickly. Try to slow down your movements. Sometimes when scanning, you might think the image is getting worse as you follow the guidance. This can generally be one of two things. 1. You have run into interference from the lungs or the ribs. In this case, continue to follow the prescriptive guidance. Then try to reestablish your image by sliding the probe above or below the rib to a new intercostal space. 2. Sometimes when scanning, the quality meter will rise and the image looks like the reference image, but the image is not auto-capturing. The auto-capture feature is highly sensitive to parameters, such as depth and on-axis orientation. In this example, you can see that the structures are visible, but the quality meter is not going up. The AI is looking for on-axis orientation, which can be achieved by following the prescriptive guidance, rocking away from the indicator in this case. Another reason why the software may not be auto-capturing the image is due to the high standards the algorithm places on the image quality to allow for multiple clinical questions to be answered. However, often these clinical questions can be answered with images that do not auto-capture, but instead are saved using Save Best Clip.